Okay, I think we can get started. Vivian, are we all clear?
Yes,
Okay, great.
thanks.
Uh,
Yes.
Perfect. We'll get started. Recording. Good morning, colleagues. COVID Conversations are brought to you by the African Alliance with support from the South African Medical Research Council and the Department of Science and Innovation and the Vaccine Advocacy Resource Group, which is 100% funded by activists. We bring you these calls in partnership with the Community Constituency COVID-19 Front, the Treatment Action Campaign, and APHA. Thank you for joining us. These calls take place every Thursday at 10 a.m. and seek to bridge the divide between civil society and those who hold power and platform in the COVID-19 space. All of our recordings, along with the transcript of the Q&A sessions, can be found at africanalliance.org.za. We encourage pre-submitted questions and welcome questions or comments in the chat box during the call, and we will do our best to answer all of them. Those we do not get to, we will reach out to our guest after the call to secure those answers, and those will be included in the transcript. So welcome, colleagues. Let's get started. The digital world has given us avenues and tools to stay in touch and be connected, to be intimate, to share, to build community since the onset of the pandemic. But it's also been a platform for hate and bigotry. Equally, it's been a platform to spread love, to share solidarity and evidence-based information. So all of these digital tools form a crucial part of our upcoming COVID-19 vaccine rollout, both to access the vaccine and also to counter misinformation and anti-vaxxer sentiment. Today, we speak to Oliver Meth, the communications lead at the South African National AIDS Council Civil Society Forum and the Community Constituency COVID-19 Front on his experiences in the communication space since the advent of COVID-19 and the potential role of a digital COVID-19 response that centers behavior change. Oliver focuses on public participation, HIV, and using alternative media as a positive advocacy tool. He has published papers on a range of development issues and researched community socioeconomics, poverty, gender, and sexuality. Oliver has been a rapporteur for local government and higher education institutes at major conferences, contributing to several media outlets and journals. Oliver, thank you for taking the time to speak with us, and welcome. As COVID-19 spreads across the country, we are faced with travel bans, project funding restrictions, and increasing need to operate remotely and build communities. A multifaceted COVID-19 digital response, including behavior change, for example, on proper hand washing, social distancing, wearing a mask, and so on, remains a critical need. And with the rollout of the vaccine, correct information and debunking this information is required to reach our communities now more than ever. As we all see during the pandemic, misinformation is a key risk in the COVID-19 response and materially jeopardizes the investments we've made in vaccine research and development. And finally, as of the 1st of February, when those first vaccines arrive on our shores from the Serum Institute of India, the challenge is really in front of us. Oliver, I'm going to ask you, thank you again for taking time out of your schedule for yet another Zoom engagement. But if you could just take the next 20 minutes to really unpack for us some of your insights learned, your lessons, your reflections on the role of digital communications in this concept of behavior change, and also perhaps unpack this concept of behavior change a bit more for us as you lead us through some of your experiences. So thank you again, welcome, and over to you.
Sure. Thank you for having me, Tian. As the Community Constituency Front, together with the SANAC Civil Society Forum, we have developed a three-part multi-sectoral social behavior change communications campaign centered around addressing misinformation and debunking myths, as you've correctly pointed out, working alongside some of our sectors and the networks within the front, and particularly creating a people-centered, tailored messaging approach. And we found that in doing this is that in trying to get these vital messages across, particularly to the remote communities and the marginalized communities that work within our sectors, has been a significant challenge from a human-centered design and implementation approach. We started this three-pronged campaign, ideally when the COVID response had happened. And now looking back in terms of some of the lessons we've learned, we're starting to unpack some of the questions around, how can we know that that the technologies that we're using are actually quite reachable and quite user-friendly to some of the communities that are accessing them through the different portals and platforms that we use. How can we work with local groups more effectively within these remote communities? And how can we tell that behavior change is actually in action in one of these communities? So one of the unique features of the web-based platform that we're currently using, which we've termed Communities Matter, is that it's owned and it's driven by civil society, and civil society both within the SENEC sectors and within the NADLAC Community Constituency Front, who are on the ground collecting data from most of the vulnerable groups who are hard to reach. And thus far, together with both these constituencies, we've reached about 14,000 people in the last 6 weeks. And we began this web-based platform rollout initially in March of last year, and it's now going into its second phase, which will then be converted into into an app mobile device. So on this platform, we discuss like important issues, particularly drawing from the sectors and the networks around their opinions, experiences, and insights, particularly around the 16 advocacy issues that the COVID-19 front seeks to address, that looks at both social and structural barriers that prevent many low-income communities from actually adhering to the COVID restrictions. So the comms campaign, which we termed hashtag Think Twice About COVID, as I've mentioned, was a three-pronged multi-sectoral campaign that implements advocacy, social mobilization, community engagement, communications, and public awareness aspects of the community-based measures and strategy for COVID-19. The campaign ideally was primarily targeted to focus on youth and vulnerable groups, using palatable language to capture online engagement, to educate and to promote behavior change in curbing the spread of COVID-19. So the different phases that we are currently rolling out in partnership with a number of other entities such as NEDLAC, UNAIDS, COVID Comms, the Ministerial Advisory Committee, and the Center for Analytics and Behavior Change at UCT. Our phase one, which kicked off in the festive season, the messaging was ideally easy, reminding people to take it easy, because ideally we thought that people are kind of COVID fatigued as they go into the festive season. The message tone was just reminding people to take it easy and to adhere to the regulations in order to curb the spread. So we took a non-policing approach during the festive season, that should people be going out to family gatherings or traveling, that they should remember to adhere to the prudent public health practices by wearing masks, washing their hands, and physically distancing as much as possible as they can. Phase two ideally kicked off when we had anticipated that the back to school and back to work season will happen, which was the second week of January. And with phase two, which we are still currently in now, there seems to be a lot of fluidity in terms of the messaging, and this is largely based on the fact that there's a lot of government changes in terms of the regulations. So we found that we had to alter some of our messaging as those ad hoc changes were made with regards to the regulations. But ideally, what we are campaigning for and amplifying through the phase two of the campaign is that we amplify particularly stuff around debunking myths around the vaccine and misinformation around COVID. We're working on a much more coordinated social mobilization and community engagement plan for public education and awareness, while still engaging in non-pharmaceutical methods. So phase two is quite jam-packed, and this will include webinars where we have experts and community leaders, because we feel that the messenger is just as important as the message if we're trying to get to like grassroots level community organizations and community people in addressing the social and structural barriers that prevent many of these low income communities from adhering to the requirements. And these include access to water and adequate sanitation, issues around the informal economy. And with the return back to work and back to school, we know that taxi ranks and public places of commuting actually become super spreader hotspots as many people gather there to take various modes of transport to and fro from work. Then we also plan to actually go out into communities and collect some testimonial videos from affected communities, ideally putting a human face to COVID and how COVID has affected many of these low-income communities. And then lastly, obviously around myth busting, particularly touching on issues of the 5G, the fact that the vaccines and the virus is colonial and it's a Western kind of concept brought in to kill Africans, and that it's DNA altering. So those are some of the aspects that we would like to address within phase 2 that particularly looks at around public education and also debunking myths, and also creating a platform for communities to engage in issues that are beyond just the pharmaceutical, but issues that affect their day-to-day and the daily kind of bread and economical living standards. And then phase 3, what we want to do is to publicize our prelim results, hopefully by mid-March, from the Communities Matter survey findings that we've been administering in 9 provinces in 25 districts that are global funded, with various sectors ranging from the traditional leader sector to the faith sector, LGBT and sex workers, who have been collecting data, which the data models are divided into 4, and ideally they ask various social behavior change questions around adherence. So the findings, what we'd like to do with the findings, we would use them as a way to inform and take forward our social mobilization and advocacy plan, as well as an integrated community engagement and public awareness derived from some of the answers and some of the inputs that we have got from the sectors who are actually administering this app within their various constituencies. So I'd like just to jump right into, I spoke about the hashtag campaign that we've been running and the particular phases that we hope that will influence behavior and also engage the public and inform our work as civil society in terms of how we can address these community-based measures, particularly within these hard-to-reach organizations and communities. And right now, what we're finding, particularly with the campaign, is that there's a lot of developments and there's a lot of dynamics, particularly around our rigor and speed in responding to some of the messages and providing a lot of clarity to these communities and to the public. And what we're finding is that in responding quickly and providing the accurate messaging, we're also finding ourselves at risk of not taking the time to understand the context and ensure that the message is clear and that it's much more palatable and that it speaks to a specific community dynamic and a specific culture within that community. So we find that because there's a lot of information that's out there, there's a lot of people that are actually doing messaging, and there are different organizations that are doing different messaging. And we're starting to now engage with the ministerial committee and other organizations such as COVID Comms to see how we can work on a much more synced phase of messaging. So people are all pulling from different sources, but are pulling trusted information from different sources that is all in sync and all in line with the topical issues that are currently happening, particularly those that are happening around the vaccine that's creating a lot of hysteria and panic amongst many communities. So we've also learned that building from these points above that I've just mentioned is that whilst we're also in a position that we must respond with speed in order to keep people informed and updated, it's also important that that we work with these sectors and work with these localized communities, particularly the community leaders within those constituencies, to have much more tailored messaging that them as the messages then portray, because then it comes from a trusted source and to a much more target audience that the community can then rely on and engage at a much more localized level than having just a web-based platform that doesn't really speak and it's not really tailored messages tailored and access to many communities who might not have access to the web. We've also recognized that there isn't a one-size-fits-all approach, and even within the small communities, we're finding that there's a lot of people that are starting to speak about traditional medicines. There's a lot of people who are starting to speak about the fact that they experienced symptoms of COVID, but had never been tested or isolated, and eventually they were cured or got over COVID. So those are some of the dynamics that we're trying to pick up within small communities that are coming from some of our constituencies. And I mean, this is quite crucial if you draw on the human-centered design experience that we had initially anticipated that we would roll out in the first phase, where colleagues then also outlined lessons that can be taken in response to the pandemic, particularly in formulating what a digital COVID response would look like. And in this form, a digital COVID response ideally would speak to a certain minority within society and not necessarily the most affected if we're looking at both the social and structural barriers of COVID within these low-income communities. So we've also recognized that many of these communities do have experience with the user or with their constituencies. And these expertise can be adapted to a remote context by using these communications tools at our disposal, both in a traditional and non-traditional aspect, in order to work with our local networks and those who don't have digital access and create much more inclusion as one of the most crucial and pivotal points for us as the Front and as CSF. So as CSF, we've been advocating for the use of more traditional technologies alongside the digital platforms that we're using, particularly being cognizant, not to introduce anything new at such a difficult time. So we are looking at combining radio programming and WhatsApp groups that build upon existing networks that are already in place, particularly amongst broadcasters, and committing to using technology that is not overly complicated and that is already in use in most communities and within most populations that we seek to reach. Just to wrap up, so one of the vital importance is that, and I think I've emphasized this as well above, is that it's quite crucial to ensure that the message and the messenger are informed and are trusted. And this is why our sector leaders within the structures and the communities play a pivotal role within our strategy in ensuring that we reach these corners of society, and particularly in employing the non-traditional modes of aspect that we do envisage as we go into phase 2 and phase 3 of our campaign, in ensuring that there's much more community dialogue, ensuring that the inputs and insights from these community organizations and the community constituencies informs our strategy, informs a much more synchronized public awareness and social mobilization and comms aspect that would feed into the community-based measures strategy on COVID-19 that the Front is developing to present back to the Ministerial Committee as a way of keeping communities engaged and keeping communities up to speed and aware of the COVID situation and vaccines and the new developments that do arise around this pandemic. Thank you.
Great, thanks so much, Oliver. Wow, it's quite a significant scope of work that you all are covering, and I know at least us at the Alliance and at the VARC are not envious in the very little communication work we do. It's pretty overwhelming. One of our former guests, Qureshi Abdul Karim, described the research landscape of COVID and trying to keep up with it all as trying to build a ship as it sails. What platform is there? What resources are there in this noise, in this overwhelming amount of noise, of information, of scientists, of opinion leaders, of thought leaders, of op-eds, of it's just a continuous pipeline. It's almost like trying to drink out of a fire hose. What would you say, and maybe this put you on the spot a bit, what would you say is your number one source? Where do you go to for this morning's most authoritative evidence-based information that you use as a basis for communities?
Yeah. Sorry. So personally, my info source would obviously be various platforms online, various news platforms online, firstly. And then I'm looking at various opinion pieces on more specific topics that I'd like to hone into to try and get different critical aspects from different experts. But I mean, we know that with any pandemic, there's always this overload of information, which ideally creates these super spreader moments that I speak about. They create panic, they create fear, that create a form of hysteria amongst society. And I think this is largely due to the miscommunication, particularly from the government aspect and for most of us within the civil society aspect, that it's not being consistent and it doesn't speak to tailored messaging that specific communities want to hear around specific issues. So I think a much more tailored approach that is in line with community-centered issues would actually minimize the panic and the fear that a lot of people have around the pandemic. So I think more consistency and listening to the issues that come from the ground and formulating those issues into a much more informed response for communities would be much more ideal, because as I've mentioned, not a lot of people actually have access to the web, as most of us have. So I think most of us find ourselves in a much more fortunate position that we have that opportunity of just Googling or looking for various reputable news sites that we can tap into and look at different critical voices that we can then draw our responses and inspiration and informed decisioning from.
Thanks for that. One of the groups that have been identified for so-called prioritized or early access of the COVID-19 vaccine is the elderly. And depending on the context, our elder folk either do or don't have access to digital technology, or they do, and perhaps they aren't, as comfortable as you or I might be in Googling or downloading an app. I mean, I have colleagues, which I will not mention, who will just be like dumbfounded by, a Facebook login. How are we bringing digital and information to those specific groups that have traditionally not been super comfortable and early uptakers of technology and digital platforms to better understand their behavior?
I think it's a yes and no question. Are we? I don't think we're doing, well, we are, but I don't think we're doing it adequately. How would I suggest that we do that adequately? I don't have a particular answer at the moment, but I know that there are various aspects and various platforms that, particularly the age group between 50 and 65 and above, actually tap into, and that's more the traditional forms of technology. And I think in formulating a COVID digital response, we should not sideline the more traditional methods of communicating, because if we do so, then we do sideline a particular portion of society that actually would be disadvantaged if we do not actually communicate effectively by using both traditional and non-traditional platforms. So I think there are an elderly population that are tapping into the digital space, but it's a very small number, and that digital space is ideally WhatsApp, if I could say. But I think we should look at both traditional and non-traditional methods of actually communicating with different spheres within society.
Thanks for that. Oliver, could you explain a bit more or share with us your experiences on how government is coming to this table? When we hear Oliver's about to speak about this, cool existing digital outreach, behavior change, one's mind immediately goes to, well, Department of Communications is behind this. You know, they're throwing money at it. They're trusting the integrity and the faith that communities have in civil society as traditional, trusted conduits of information. And they're fully behind it. The mobile network providers are fully behind it. To what extent has your work been supported or not by government and private sector?
So the work that the Civil Society Forum does together with the Community Constituency Forum, there's various aspects of the communications budget that's been sponsored by mainly the international development agencies such as the UN Family. There's been very little support, or actually no support, for a comms budget from the government entities, but there has been a lot of collaboration and conversation around working particularly with GCIS and the Solidarity Fund under the Ministerial Advisory Committee on Social Behavior Change in crafting much more tailored messaging that will inform the community-based measures that we speak about as civil society. So there's a lot of collaboration with some government departments and government entities, but there hasn't been direct pouring of resources at this stage into any work that we've been doing within civil society around communicating within communities and collecting data from communities that would inform policy and ideally the rollout of the vaccine plan.
Can we expect a call coming out soon from the Community Constituency COVID-19 Front and SANEC Civil Society to these, what appears, at least from the outside, is very obvious almost, people who have a mandate to support your work? We keep on discussing that we've transitioned as civil society really to accommodate the needs of this pandemic, but we're just not seeing the funding to do our work. Any advocacy plans that you can share, any intentions to hold those with power and resources specifically to account to support the work that you are doing, which they perhaps to some extent don't have the capacity to do?
Yeah, sure. As the front end, as the Civil Society Forum, I mean, we never shy away from calling those in power to account. But we are in conversations with various stakeholders within that sphere in formulating how we can take this comms model that we have implemented around the Think Twice About COVID campaign to a much more district level that will sink into the SANEC model that works with district and both local AIDS council districts, and how that can filter into the different aspects within communities. So there are discussions around how that model, or how this model that we've just developed would then be synced into the local AIDS council districts, and how that model will be funded by particularly provinces and various municipalities and districts within those provinces. So there are discussions, and we're hoping that those discussions will turn out to be fruitful. It is a back and forth, numerous meetings. Some have been postponed on numerous occasions, but we do feel after yesterday's meeting that we are heading somewhere, and we should have a plan and some sort of public announcement once this happens in the next coming weeks.
Great, thank you. Wish you well with those efforts. What early impressions, perceptions, data, if we're at that stage yet, have you seen coming out of this Think Twice about COVID-19 outreach? How is it being received? Where is it being received? What are some early reflections around that campaign?
Okay, so the most province where our mobilizers have collected data from is the Eastern Cape, KwaZulu-Natal, and Gauteng. And most of the data that we're seeing now, so we're taking data on specifics on demographics, are people working or not working, what are some of the social behaviors, or what are some of the social or structural barriers that prevent them from actually adhering to some of the prescribed regulations, particularly under level 3 at the moment. And we're finding that there's a lot of misinformation, particularly within communities. We're finding that most of the communities that have been surveyed, COVID is not actually their main issue within those communities. People are still complaining about infrastructural issues within informal sectors. And we're finding that these issues around structural, informal structures, adequate access to water and sanitation, actually some of the issues that are actually preventing most of these people from adhering, because some people are like also saying on the app that they live in corrugated iron structures, and their shacks are built at least a meter from one another. So it's impossible for them to actually physically distance. It's impossible for them to stay indoors all day because it's so hot and the tin roof contracts a lot of heat. So they have to sit outside. And when they're outside, they socialize with people because they're just against one another. And the use of communal bathrooms and communal taps. So what we're hoping to achieve through the community-based measures by deriving from some of that data is that COVID, particularly for these low-income communities, should not just be looked at as this pharmaceutical thing about accessing vaccines alone, but should be looked at addressing these other issues that communities face that actually prevent them and put them at risk of contracting COVID. And if we don't do these immediately by addressing these structural issues as well, we could be at a risk of a wider spread within lower communities who ideally don't have access to adequate public health care, and who ideally don't have the means for a COVID test or to actually adhere to the regulations because of their living environments and conducive environments, well, non-conducive environments within society.
Thanks for that. So in the work that you've been doing so far in the pandemic, what has stood out to you in a moment of, gosh, we could have used this approach or still can use this approach in the HIV or TB space? Have there been any crossover similarities that struck you as particular opportunities that the broader sector could learn from?
I haven't thought specifically about that, but I have been thinking about a lot of comparisons that were used, particularly around behavior change within the HIV pandemic. Was that there was this constant messaging around fear, of fear mongering, the triple C's. If you don't wear a condom, if you don't get tested, and I feel that the first phase of our messaging, particularly around COVID, was around fear mongering, and this is why a lot of people had started resisting wearing masks, washing your hands. Because it was so ingrained as a policing strategy and not as a non-policing strategy to then leave it, to then educate people, to then be much more informed, to make that informed decision about the effects of not and the effects of doing so. And I think that's what we should be doing ideally when we are messaging with people, as we initially done within the second phase of the HIV pandemic, is that we shouldn't message to perceive fear onto people, but we should message to leave people with informed choices. And by so doing, we should give people the pros and the cons of that. And by weighing those pros and cons, then I think people will be much more informed to then decide or make that decision whether or not they would want to adhere to a prescribed regulation. If that was clear, it was a bit of a fumble.
Yeah, no. Interesting reflections. I want to touch more and now go into this concept, idea, approach of behavior change or human-centered, a human-centered approach. We know, for better or worse, we have predominantly US-based international NGOs who are in this country who do a lot of work trying to understand the motivators and the drivers of human behavior, especially with regards to HIV and prevention. What evidence is your approach using, if any, from those particular approaches that we're looking at behavior change in the context of HIV and a human-centered approach in terms of the digital component of your work?
So you're asking what indicators are there?
Yeah, so has the work that you're doing reflected on the progress and challenges that have been faced by the HIV space in terms of understanding human behavior and a human-centered approach?
Yes, it surely has. So a lot of the work that the CSF is doing together with the Front is using the interlinkages of HIV and TB and COVID in addressing it as a quadruple pandemic that society faces, by ensuring that people who are actually on treatment and are receiving access actually have equal access to the treatment during the pandemic time. So we're using messaging and behavior change to encourage people to adhere to to encourage people to seek treatment and to encourage people to get tested and screened in order to be informed and to protect themselves and those around them. So that's the kind of human-centered approach that we are using by centering people and their needs and their response to access for treatment as a pivotal role within the pandemics.
Yeah, yeah. Anna and Vivian are asking, how can we be assured that behavior change is in action? Which makes me think, so we'll have this cool digital platform and people will see, you know, you get a very sexy looking guy with no shirt and a mask in one of your, I remember it for better or worse, in one of your messaging. So you see that information, and how then do we know if that person who's seeing that post is actually wearing their mask above their nose? How are we tracking the impact of this behavior change intervention?
Yeah, that's quite tricky because behavior change is quite tricky to actually track. It doesn't have an indicator. You can't really tell that the work that you're doing actually has an impact or has directly impacted on a specific community. But how we are actually measuring our impact with in the messaging that we're doing, together with the different stakeholders that we're working with, is ideally looking at the infection rate and the treatment rate within the specific community and specific districts as a form of education and as a form of ensuring that our messaging is reaching a lot of people. So ideally, the more people who then get tested and treated, the more effective our messaging around testing and treating then becomes within that specific space. So there isn't an actual indicator to actually tell that because people are getting, because more people are actually getting treated, that it's a result of the messaging that the COVID Front is doing. So there isn't an actual indicator, but on the basis of the progress within the community, we're hoping that the impact of our messaging does actually speak to the work that we have been doing within those spaces.
Yeah, thanks for that. So last night, Minister Mkhize shared how we as a country are going to begin to roll out this first phase. And I know certainly the various work streams on the MAC have been working on how we segment and stratify these different groups of people in terms of access and prioritization. What are some of your reflections on this first phase of the rollout, specifically as it pertains to communication and digital outreach?
I think the announcement was a bit too late, although it happened, eventually happened, because there was still a lot of confusion in terms of what the phase one rollout plan would look like, particularly around logistics, who would be administering it, the procurement issues, the accountability and transparency around that as well. So I think that the fact that him and his department has now eventually communicated what the rollout phase one plan still looks like, I think there should have been more work done prior to that by engaging communities and civil society organizations in what a phase one rollout plan should ideally look like for the people, and not one that's imposed on the people. So I'm quite skeptical about the phase one. Well, I'm quite skeptical about the whole rollout plan, whether it would be effective. I'm quite skeptical on a number of bases, particularly around accountability, transparency, and the fact that there isn't a clear blueprint as in who would be administering it, where, how many per province, the timeline, etc. So there's still a lot of confusion that I'm trying to grapple my head around. But last night's announcement did provide some clarity, although I still think that more needs to be done. And that more needs to be done in conjunction with various stakeholders within society, in ensuring the clarity.
So we're about 3 days away from these vaccines arriving. We're about 14, most likely 20 days away from the first vaccine being administered. What are your priority messages and focuses in the build up to that, to ensure that at least that first group, what we've now characterized as healthcare professionals, which include about 18 subcategories there, what are your messaging and communications plans specifically digitally to engage this group of people?
Firstly, just a bit about what the different vaccines are. Also information around scientific information around if any side effects, the distinction between the 1 dose, 2 doses, the importance of why healthcare workers should ideally be receiving it first, and then debunking some of the myths and misinformation around the vaccines and COVID in general.
What has been the most damaging piece of misinformation that you have come across thus far into the pandemic?
That that once we get injected with the vaccine, there will be a microchip inserted in us, and it will be a means for Bill Gates and the powers above to track us and control us. But the most fascinating one that I've read, I think it was about 2 weeks ago, which builds further to the DNA altering conspiracy, was that the West was injecting Africans on Africa to control them into slavery. And this was a colonial project that the West had initially started. And now it's been enforced through Bill Gates and Ramaphosa as a puppet of white monopoly capital. It's quite interesting to read that opinion piece on Black opinion, written by the very prominent BLF leader.
Yeah, it's certainly been a ride. So we've got some questions, but before we go into those, one more question from my side. How do we support colleagues, comrades, fellow activists, those who are in our space, those that we've worked with for decades in the HIV space, in the human rights space, in the GBV space, that are very clearly hesitant to this concept of vaccines, and that they themselves perhaps don't believe in whether it's vaccine safety or vaccine efficacy? How do we put, because if you look at the evidence, in South Africa, we don't really face an anti-vaxxer problem, but we face this huge vaccine hesitancy problem. And of course, it's in a context. It's an historical context, whether it's medical experimentation during apartheid, or it's just an inherent mistrust of a public health system that has failed us so reliably over year after year after year. So how do we begin, how do we start at home with our own comrades and our own colleagues who still have reservations and hesitancy around the efficacy and safety of vaccines?
Mm-hmm. Oh, that's a tricky one, because we, but in the spaces that we work, we still have a lot of resistance, particularly to the messaging that we're doing around the vaccine, and resistance within the circles that we work within, particularly within the traditional health sector, where the traditional health sector that we work with is particularly advocating for much more mixed approach to give the public more options by westernized medicine and the traditional kind of remedies that are available through some of those constituencies that are being provided. So I actually don't know what's the correct answer and how do we address that. But I think there is room, and even more now so that the conversation is kind of flaring up, is that there should be more public engagement about these different aspects and use of medication that people are resisting or becoming hesitant to, and working around a way of how we can incorporate much more African medicine into our public health responses, alongside the Western and other pharmaceutical methods of prevention that are required in combating the spread. So I think it's largely based on sciences, and I think a more scientific debate and conversation needs to happen at local levels for more better understanding, more engagement, and to create inclusion and inclusivity to ensure that that communities are then informed to make that informed choices whether or not they decide to take the vaccine or not, or they decide to go the traditional way by indulging in traditional remedies.
Do you think our communities are conceptually clear, number one, on the existence of the national regulator SAPRA, and number two, the role that SAPRA is playing in terms of indigenous knowledge, medicine systems, and embrace such options for research to finally get what the West might tout as old traditional remedies to be scientifically proven in order to get those into people's homes and into people's hands? Do you think people are confident and excited about the existence that we have this body in South Africa that is set up and mandated by law to do exactly that?
I don't think people are that confident, and I think people are just starting to know and to hear and to learn about what actually SAPRA does now during this pandemic. I think SAPRA has just been a quiet body that hasn't been really vocal in the past years. But I think now's the time for SAPRA to actually step up and actually include these different conversations around scientific testings and scientific methodologies around traditional medicine as well. So I think this is the chance for SAPRA, but I also think that SAPRA is really heavily constrained, both financially, as they have mentioned, but I also think that there's a lot of political pressure on them. And as we've seen with the ivermectin, that there was a lot of debate around it, and it seemed as if SAPRA was heading towards the direction of completely dismissing the use as a COVID remedy. And I think with all the political pressure that then came over the past few weeks and the advocacy and the high court cases that were lodged against them, that they amounted to political pressure to then prescribing it as a compassion drug for COVID-19. And what a compassion drug for COVID-19 is not really clear. And I think a lot of people within the traditional sector would actually say, well, traditional remedies are also compassionate drugs, because they address specific symptoms within, but do not really cure COVID. So I think the ambiguity and the biasness of the regulator actually needs to be called out and needs to be addressed from all spheres of society, that political pressure should not amount to actually putting people at danger and putting people at harm. And if so, then I think traditional remedies should also be given the same platform by undergoing scientific testing and regulatory, then to inform what a compassionate remedy would look like for COVID within the space.
Absolutely. I think that's such a powerful comparison between the discussion on ivermectin and traditional remedies. It's, at least to my mind, certainly almost the same argument. You know, we've been saying, let's test this, no matter what this is, let's test it. And so see perhaps what is called in some circles unconscious bias. But anyway, so we can move on to, we've got two questions in the chat. And policy is saying, he's trying to understand how the information will get to far rural areas, such as Middle Drift, due to poor service rendered in the area. He's speaking about this in terms of testing for COVID. It's not visible, they only see it on TV platforms, and it's only when someone dies that they do testing. So could you speak, you've touched on it already, but could you speak a bit more in terms of your specific plans targeting rural areas with messaging information?
As I mentioned, the Communities Matter web-based platform, which would be turned into an app platform as well by June at least, has been administered by a range of community mobilizers within the 25 global funded districts, which goes across the country in all 9 provinces. And once the mobilizers are at a specific residence and have taken the questionnaire, which is a screening questionnaire ideally, should that questionnaire outcome then require the person who's been questioned to then be referred, then there's a referral process that the mobilizer will go through in ensuring that that the person who's been interviewed is actually referred to the local clinic for further testing and further treatment. So we're using the outcomes of the data on the app as a referral system, These are mobilizers actually not trained as healthcare workers to actually then administer whatever pharmaceutical or medical attention that the respondent might need. So it's been used to derive information, and from that information, we use that as a referral system, either for the healthcare workers to visit the family or for the family to then seek referral at the healthcare system, at the healthcare location within their district.
Yeah. Thanks for that. Malibongwe from TB HIV Care is asking, is your message totally devoid of HIV? Is it really just COVID? How is HIV integrated? Could you speak a bit more to that? And I imagine by extension, TB and SDIs.
No. No, it's not completely devoid. We do add aspects of TB, particularly around our advocacy and HIV and other structural barriers such as gender-based violence. So we're looking at different advocacy points within our messaging that I've highlighted that the front and that the civil society forum looks at. And it's not just messaging particularly around COVID, but it's messaging around all these barriers that interplay into COVID. So access to data, the informal economy, issues around gender-based violence, HIV and TB. So it's not completely devoid of just COVID, but we're looking at aspects that play into the everyday lived realities within society within this time of COVID.
We are reaching top of the hour. Time flies when you're having fun. Oliver, is there anything else that you would like to share with us that we've not covered as a parting word?
No, probably if people can just, subscribe to our pages, follow us as well. We have a website as well, communityconstituency.org.za. The campaign website is thinktwiceaboutcovid.co.za, and our social media platforms are available for direct linkages to there. If there are any other organizations as well who are on the call who are also doing similar campaigning, we'd like to partner up with them as well and see how we can work on a much more synchronized messaging to reach various aspects of our communities.
Great, thank you so much. Colleagues, Oliver Meth is the communications lead at the South African National AIDS Council Civil Society Forum and the Community Constituency COVID-19 Front. Oliver, thank you so much for taking the time and sharing with us. It's a pleasure to speak to you. Before we end, colleagues, we'd just like to share, for those of you who have not seen the African Alliance, the Vaccine Advocacy Resource Group, in partnership with our partners at Y+ Global and the Ready Movement, are bringing you 4 lectures. They start today. These 4 lectures will cover the 4 pillars of the upcoming IAS conference. We've put together an amazing panel of speakers to deliver those lectures, and we encourage you to sign up and join. They're on all of our social media platforms. And we will be giving away free registration to the main IAS conference that begins next week. And we look forward to engaging. The purpose of these lectures are really to build our individual technical skill set on basic science, vaccines, non-pharmaceutical interventions, and global access and policy, to ensure that conferences like the IAS, that have traditionally been exclusive, very expensive to attend, and out of touch of communities, we really begin to bridge that gap. So we encourage you all to please sign up and join us. Again, Oliver Meth, thank you so much for your time this morning, and thank you everyone for participating. Have a great Thursday further.